Turning now to the latest in the coronavirus pandemic. Despite COVID-19 infection rates slowing down a bit here in New York City, hospital workers say much more needs to be done to stop the spread. Nurses speaking out today at New York City Health and Hospitals Jacoby about working conditions they say have become unbearable. News 12's Noelle Lilly was there and tells us what they say needs to change.
Our healthcare system was never designed for this.
During her shift as a registered nurse, Karen Lamb sometimes takes care of up to 14 patients all by herself.
It's nonstop from the moment I step in the door to the moment I leave.
Sometimes Lamb says she doesn't even have time to eat or use the restroom. Today, she joined nurses across the 5 boroughs to call for better working conditions as the city continues its fight against the COVID-19 pandemic.
I'm expected to medicate all my admitted patients on time, but oh wait, Bed 9's family member wants an update immediately, and the gentleman in the hallway is screaming for a nurse because he can't breathe. But I also have to draw blood.
Hospitals around the country have been understaffed and overcrowded.
I can't split myself down the middle. I can't split myself into 10. And because I don't have that ability to be 10 people at once, I know that I'm neglecting some of my patients.
Lamb says hospitals need to hire more nurses, especially as she sees more and more of her coworkers quitting. Nurses we spoke to also say they're not happy with new CDC guidelines that say employees can return to work after only 5 days, even if they still test positive for COVID.
You have to take care of yourself before you can take care of others, and we can't continue just selling ourselves short.
And they say ultimately it's the patients who suffer most. We reached out to NYC Health and Hospitals, who said in a statement in part that they will continue to hire hundreds of nurses in the days ahead and are transferring patients across hospitals to balance. In Pelham Parkway, Noelle Lilly,